Hey there and welcome. When you think about your health, you probably think it's, well, personal, right? But what if I told you the big rules, the ones that really shape your healthcare, are being written on a global stage by a whole cast of characters you might not expect? So, who really holds the power over our health? Let's dive in and find out.
Really think about it for a second. Who do you imagine is making the big decisions about your country's health policies? It's your own government, isn't it? You know, the ministers, the folks in the civil service, maybe some local companies or unions. And you know what? For a long, long time, you'd have been absolutely right.
But these days, that picture is just totally incomplete. In our super-connected world, the whole decision-making process has just exploded way beyond any single country's borders. It's become this huge, complex web of international players, and they all have a say. So, who exactly are they?
All right, let's start with the big guys, the official players. I'm talking about those large, formal organizations the governments themselves create to deal with problems that affect all of us.
Okay, so the official term for these is intergovernmental organizations, or IGOs for short. The easiest way to think about them is like a club, but the members are entire countries. They're the ones who hammer out treaties and create the rulebook for how nations are supposed to cooperate on, well, everything from fighting pandemics to managing global trade.
Now, when it comes to health, the most famous IGO is, of course, the World Health Organization, the WHO. It's been around since 1948, and its whole job is to be the world's coordinator for all things health. All the member countries get together, they approve budgets, they set global health policy. It's supposed to be the planet's top health authority. But, and this is a big but, there's a catch.
And right here, you can see this massive power imbalance. See, the WHO, most of its recommendations are just that, recommendations. They're basically voluntary suggestions. But then you have another IGO, the World Trade Organization, the WTO. And their rules on trade, they are legally binding. Countries have to follow them. And even though the WTO is all about commerce, its decisions can have these huge, sometimes really unexpected impacts on public health.
Here is a perfect, and I mean perfect example. The WTO has this agreement on intellectual property. It's called TRIPS. And what it does is it forces countries to recognize drug patents for a full 20 years. Think about what that means. It can seriously delay cheaper, generic versions of life-saving drugs from ever getting to the people who need them. We're talking about a trade rule that literally has life or death consequences.
Okay, so we have the official treaties and the IGOs, but that's only part of the picture. There's another huge force out there, one that's just as powerful. And it shapes health policy not with rules, but with cold, hard cash.
You know, it wasn't that long ago that if you looked at where global health aid came from, it was basically a small club of maybe 15 wealthy Western nations. Well, today, that whole map has been torn up and redrawn. You've got emerging economies like China, India, and Brazil stepping up as major donors. They're funding everything from hospitals to anti-malaria programs, and they're bringing totally new ways of doing things to the table.
And then you've got the private giants. I'm talking about philanthropic organizations like the Bill and Melinda Gates Foundation. These guys operate on a scale that honestly rivals a lot of governments. Their budget is so enormous that when they decide to fund something really ambitious, like, say, trying to completely eradicate malaria instead of just controlling it, they can single-handedly set the entire global health agenda. They can shift the world's priorities just by where they put their money.
So we've got treaties, and we've got big money. But power isn't just about those two things. There's a third force that's elbowed its way onto the world stage and become a major player. Organized groups of regular people.
The term for this is global civil society. And really, it's this massive, sprawling network of NGOs, activists, and social movements that all work across borders. Now, they don't have the official power of a government or the massive checkbook of a foundation, but what they do have is influence. Influence that comes from their expertise, their passion, and their ability to mobilize people.
Want a great example of this in action? Look no further than the Global Tobacco Treaty. The NGOs weren't just outside with signs. No way. They were inside the room. They were directly lobbying the country delegates. They were providing all the technical research and expertise that the officials desperately needed. They were watchdogs, famously calling out bad actors by giving a daily Dirty Ashtray Award to the country doing the most to block progress. And maybe most importantly, they built a huge global alliance to coordinate all their actions. They became one, unified, powerful voice.
Okay, let's pause for a second. We've got national governments, we've got these IGOs, we've got giant philanthropists, and we've got global civil society. It's a lot. It's a crowded room.
So how on earth do we make sense of it all? How do all these different pieces actually fit together?
Well, the old way of looking at this was something called the Iron Triangle. The idea was that policy was basically just a negotiation between three groups, all inside one country. You had your elected politicians, the government bureaucrats who actually run things, and then the local interest groups, corporations, unions, all trying to get what they want. It was this neat, tidy, closed loop, all happening at the national level.
But as we've just spent the last few minutes seeing, that simple little triangle, it just doesn't work anymore. It can't explain how health policy gets made today. That closed loop has been completely busted open by all these global forces.
So to try and map out this new reality, experts have come up with a new model, and it's called the Golden Pentangle. It's pretty cool, actually. It takes our original 3 points from the Iron Triangle, the elected officials, the bureaucrats, the interest groups, and it adds 2 brand new global points. The formal international organizations we talked about, like the WHO and WTO, and then all those informal global networks like civil society. Health policy today is hammered out in the messy, complex push and pull between all 5 of these players.
So what does all this actually feel like for the people on the ground? Well, this quote from a health minister just says it all. He said, "I thought I was the Minister of Health. Instead, I found I was the Minister for Health Projects run by foreigners." He thought he was in charge, but he realized he was really just juggling a bunch of projects that were all being run by people outside his own country.
The result is what some people call a cacophony of inputs. Just imagine being a national government, especially in a country with fewer resources. You're trying to create one single, coherent health plan for your people, but you're being bombarded with competing demands, different priorities, and endless reporting rules from dozens of different global players. It's not just complicated, it can be completely overwhelming.
And all of this brings us to a really big, really important final question. When power is spread out this much across so many different global actors, some of them are elected, some aren't, some are public, some are private, who, at the end of the day, is actually responsible? In this new world of golden pentangles, who is truly accountable for our health?